Infections are caused by harmful microorganisms such as bacteria, viruses, fungi, or parasites entering the body. Recognizing the type of infection is the first step toward effective treatment. Symptoms can range from mild discomfort to severe illness, depending on the organism involved. Early identification helps guide the best treatment approach. In this video, we'll explore the most common treatment options for various infections, helping you understand when to seek medical help and what to expect from different therapies. Bacterial infections are among the most common types of infections. They can affect any part of the body from the skin to internal organs. Common examples include strep throat, urinary tract infections, and pneumonia. These infections are typically treated with antibiotics, which target and kill bacteria. However, it's important to use antibiotics responsibly to prevent resistance. Your healthcare provider will determine the best antibiotic based on the type and severity of the infection. Antibiotic therapy is the cornerstone of treating bacterial infections. These medications work by either killing bacteria or stopping their growth. It's crucial to complete the full course of antibiotics even if you start feeling better, to ensure all bacteria are eliminated. Misuse or overuse of antibiotics can lead to resistance, making future infections harder to treat. Always follow your healthcare provider's instructions regarding dosage and duration. Viral infections are caused by viruses, which are different from bacteria. Common viral infections include the flu, common cold, and COVID-19. Unlike bacterial infections, antibiotics are not effective against viruses. Treatment usually focuses on relieving symptoms while the body fights off the virus. In some cases, antiviral medications may be prescribed, especially for severe or chronic viral infection. Antiviral medications are designed to treat specific viral infections. These drugs work by inhibiting the virus's ability to multiply, helping the immune system clear the infection more effectively. Examples include medications for influenza, herpes, and HIV. Not all viral infections require antivirals, and their use depends on the type and severity of the infection. Your doctor will decide if antiviral therapy is appropriate for your condition. Fungal infections can affect the skin, nails, lungs, or other organs. Common examples include athlete's foot, ringworm, and yeast infections. These infections are treated with antifungal medications, which can be applied topically or taken orally, depending on the severity and location. Early treatment is important to prevent the infection from spreading or becoming chronic. Antifungal therapy involves medications that target and eliminate fungal organisms. Topical creams are often used for skin infections, while oral or intravenous antifungals may be needed for more severe cases. It's important to use these medications as directed and complete the full course to ensure the infection is fully treated. Some fungal infections can be persistent, requiring longer treatment. Parasitic infections are caused by organisms such as protozoa, worms, or lice. These infections can be acquired through contaminated food, water, or insect bites. Treatment depends on the type of parasite and may involve antiparasitic medications. Early diagnosis and treatment are crucial to prevent complications and transmission to others. Antiparasitic medications are used to treat infections caused by various parasites. These drugs are tailored to the specific organism involved. For example, medications for malaria differ from those for intestinal worms. It's important to follow your healthcare provider's instructions closely, as some treatments may require multiple doses or follow-up testing. Supportive care plays a vital role in managing infections, regardless of the cause. This includes rest, hydration, and nutrition to help the body recover. Over-the-counter medications may be used to relieve symptoms such as fever or pain. Supportive care complements specific treatments and helps speed up recovery. It's important to know when to seek medical attention for an infection. Warning signs include high fever, persistent pain, difficulty breathing, or symptoms that worsen despite treatment. Early intervention can prevent complications and ensure you receive the most effective therapy. Don't hesitate to contact your healthcare provider if you're concerned about your symptoms. Prevention is always better than cure. Good hygiene practices such as regular hand washing, safe food handling, and vaccinations can significantly reduce the risk of infections. Avoiding close contact with sick individuals and keeping your environment clean are also important preventive measures. Antibiotic resistance is a growing concern worldwide. It occurs when bacteria adapt and become resistant to the effects of antibiotics, making infections harder to treat. Responsible use of antibiotics, such as not using them for viral infections and completing prescribed courses, helps combat resistance and preserves the effectiveness of these vital drugs. Vaccines are a powerful tool in preventing certain infections. They work by training the immune system to recognize and fight specific pathogens. Common vaccines protect against diseases like influenza, measles, and hepatitis. Staying up to date with recommended vaccinations helps protect both individuals and communities from outbreaks. For mild infections, certain home remedies can provide relief. These include warm compresses for skin infections, saltwater gargles for sore throats, and adequate rest. However, home remedies should not replace medical treatment for serious infections. Always consult a healthcare provider if symptoms persist or worsen. Severe infections may require hospitalization for advanced treatments. This can include intravenous antibiotics, fluids, or even surgery in some cases. Hospital care ensures close monitoring and rapid response to complications, improving the chances of a full recovery. In some cases, surgery may be necessary to treat infections. This is often required when an abscess needs to be drained or infected tissue must be removed. Surgical intervention is usually combined with medication to ensure complete recovery. Your healthcare team will discuss the risks and benefits if surgery is recommended. Monitoring your progress during treatment is essential. This may involve follow-up visits, blood tests, or imaging studies to ensure the infection is resolving. If symptoms persist or worsen, your treatment plan may need adjustment. Open communication with your healthcare provider helps achieve the best outcome. Some infection treatments can cause side effects such as nausea, diarrhea, or allergic reactions. It's important to report any side effects to your healthcare provider, who can recommend ways to manage them or adjust your medication if necessary. Never stop treatment without consulting your doctor. Some infections can become chronic, meaning they persist for a long time or recur frequently. Examples include tuberculosis or hepatitis. Chronic infections often require long-term treatment and regular monitoring. Working closely with your healthcare team is essential for managing these conditions. People with weakened immune systems, such as those with HIV or undergoing chemotherapy, are at higher risk for infections. Treatment may be more aggressive and involve additional precautions. Preventive measures and early intervention are especially important for these individuals. Children are particularly susceptible to infections due to their developing immune systems. Treatment options may differ from adults, with careful consideration of medication dosages and potential side effects. Pediatricians are trained to manage infections in children and ensure safe, effective care. Older adults may experience infections differently due to age-related changes in the immune system. Symptoms can be less obvious, and treatment may need to be adjusted for other health conditions or medications. Prompt diagnosis and tailored therapy are important for this age group. Pregnant women require special consideration when treating infections. Some medications may not be safe during pregnancy, so healthcare providers choose treatments that protect both mother and baby. Early detection and appropriate therapy help ensure the best outcomes. Traveling to certain regions can increase the risk of specific infections such as malaria or traveler's diarrhea. Preventive measures, including vaccines and prophylactic medications, are important before and during travel. If you develop symptoms after returning, inform your healthcare provider about your travel history. New infectious diseases can emerge, such as COVID-19, requiring rapid development of treatment and prevention strategies. Staying informed through reliable sources and following public health recommendations are essential for protecting yourself and your community. The immune system is your body's natural defense against infections. A healthy lifestyle, including balanced nutrition, regular exercise, and adequate sleep, supports immune function. Some treatments may aim to boost the immune response, especially in cases of chronic or severe infections. Some people explore alternative or complementary therapies for infections, such as herbal remedies or acupuncture. While some may offer symptom relief, it's important to discuss these options with your healthcare provider to ensure they are safe and do not interfere with standard treatments. Public health measures such as quarantine, isolation, and contact tracing help control the spread of infectious diseases. These strategies are especially important during outbreaks and pandemics. Cooperation with public health guidelines protects both individuals and the wider community. Infections can be caused by a variety of organisms, each requiring specific treatment options. From antibiotics and antivirals to supportive care and prevention, understanding your options empowers you to make informed decisions. Always consult your healthcare provider for guidance tailored to your individual needs. Stay proactive about your health and remember that prevention is the best medicine.